like that. But we'll work on that. But you can
on the side that's stuck.
Yeah, but you can practice this Sutherland's grip if it feels like it will help release this, and this might help because the maxilla is going to inhibit her sphenoid from being free once you get it. Okay, so that's that. And then the second grip is really cool. It gives you a lot of control over this. So you imagine if you look at a skull, the coronal suture is about right in the same plane as this phenobasilar joint. So it's almost like the head is hinged right down through here, right? And so what you do is you cup the occiput like that, and I've got my fingers pointing straight down that way. Then you put your little finger up in the cheek, and then just again span the thing like this, and I've got the two halves of that thing, and then I can encourage her sphenoid towards the ceiling and let it do unwinding. So again, from here, this position, I can put in no test motions, I can put in torsion motions, I can put in side bending motions, torsion motions, compression, decompression, and again, she's bound down more on the left side of the head than the right. But practice those holds too, not just the cranial first vault hold, but the Sutherland's grip and then the cup and straddle, it's called.
What do you do with that little finger that's in the mouth?
It's just kind of
It's just hanging out there.
stabilizing and monitoring, yeah.
Monitoring the maxilla.
Yeah.
Okay.
I don't know why it just gives it some place to be, I guess.
In between the cheek and the jaw?
Yeah, so it's right up, I'm actually hooked right up under the zygoma here. The little finger's right there.
So you're not on the molars so much this time?
Right.
It could be outside too. I mean, because you'd have the same hold on the greater wings.
You could. I guess if you didn't have a glove, you could do it that same way. For some reason, this gives you a little more control of it.
And you're cupping you're cupping it, and then are you assessing or are you treating?
Both. But you can put in little test motions, or like from here, see if I move my right hand towards the ceiling. So how does that feel, Linda, inside? What is that? As I'm moving it. The side stuck, yeah. So then you could always stop and come and do direction of energy, but I think if it just held that position a little longer, it would work itself loose. And from this position, you can actually really follow it as it unwinds and work it and kind of shake it and get it to free up and stuff.
So does it feel like it's tighter when you're saying jammed up? Means that it's shorter, it's pushed up towards that
and not moving.
The left side. Okay.
Yeah, so when you put the little test motions in. So like if from this position, I put a test motion in, this part opens, this part doesn't, so it feels like it's rocking. You can just imagine it pinned here and rocking around that pin, when it really should go like this. But it's not, it's pinned down.
How would you encourage that to release?
Direction.
I would just keep encouraging it towards the ceiling and just work it. Just put little motions in and work it, and beam energy into it, and yeah. But I would also decompress the maxilla, which we'll do next month. You have to wait a whole month. No, but these 2 months work like a unit, like the first 2 months did, where we were just doing the cranial 1 level of stuff, and so working this whole area is pretty much a unit, and that includes the sphenoid and the hyoid and that whole area. But yeah, you're definitely pinned down on this side somehow. So those are the. So go ahead and let's pair up for this one. So we'll have to set up 2 more stations in the other room, and just to, again, assess the sphenobasilar joint. And just imagine putting in the test motions for the other 3 lesions, okay? Just test for them. But be gentle, because you don't want to induce the lesions in somebody. Okay? And if you're getting over your head, call me.